Mel had asked me to do an update on sleep medicine, and I had started to prepare for that talk, and all of a sudden I looked on my email and saw an announcement of a recall. And I thought, recalls happen all the time. I said, well, Respironics CPAP recall. And then I said, well, maybe I need to look into this and what, okay. There we are. I think, so what I discovered is the perfect storm. And that is we're coming out of the pandemic where we have a lot of patients going home on ventilators. The sleep labs have kind of been slowing down, which is sort of a good news, bad news if you're in sleep medicine. But this is a major recall. Respironics has a big footprint, and it not only involves their CPAP devices, but their BiPAP devices and their home ventilators. So Dr. Barney, talks about using BiPAP in the hospital, and he's probably hasn't not fully realized what's happening here. Just a little disclaimer here. I don't know anything more than what I'm reading online. Nobody has shared with me insider information. And basically, I do try to keep up with what's been going on. I have no vesting with any of the home ventilator companies, Respironics, or the other manufacturers. And basically, the slides I'm showing you today were snipped out of Respironics' website as well as the FDA. There are a smattering of slides from the ASSM, American Academy of Sleep Medicine, some of the other product manufacturers, Sleep Multimedia, and Up to Date. So this is who does this affect? Obviously it affects our patients, no doubt about it. It also has a major impact on Respironics. This is a big product line for them, and they're scrambling to try to get ahead of this. Hospital systems that send out patients on home ventilators and supply it out of their supply chain are going to be affected. Our local DMEs are affected by it. Home care organizations that do management of home ventilators are affected by it. Physician practices, and I'd be pulling what little hair I have left out if I was still in practice right now trying to deal with this. Our regulators, CMS, Medicare, FDA, the insurance carriers are affected by this. And it wasn't too long before I saw the proverbial emails from lawyers wanting to start a class action suit against Respironics. And I'm going to try to not get into the medical legal aspects of this. I went back and looked at the FDA website, and this is a very important slide. FDA reminds patients that there are no approved devices that use UV or basically ozone to clean CPAP devices. Very important. This was from about 2 years ago. So the FDA had already picked up on an issue. And I don't know, I'm not going to mention the name of the company, but they've been hot and heavy advertising home cleaners for CPAP that are not approved by the manufacturer. And that's just a restatement of that. There are no home cleaning devices other than the usual routine, which we'll talk about, that have been approved by either the manufacturer or the FDA. On top of what we're going to talk about, which is particulate, there's also off-gassing, which means that there's audio abatement foam in all of our CPAP devices and our home ventilators. And the Respironics company had a foam that started releasing VOCs, and we'll talk about that in a little bit. So I went to the Respironics website, and there's the crux of it. Urgent recall. So we're going to talk about that. Included in that recall is bilevel PAP devices as well as CPAP. It's all related to the sound abatement foam. And this is familiar to those of you who are hospital-based, the Trilogies, the BiPAP V30s, and a couple other devices. So how many devices are affected? I saw a figure of 13 million in this country. I saw a figure of over 40 million devices worldwide. Basically, the one thing to remember is that 35 million people afflicted with obstructive apnea. It's a good news, bad news situation. The majority of the 35 million are not on CPAP. And not all people who are on CPAP are prescribed CPAP are going to use their device. But there is a subsegment of patients, about 20% of that 13 million, who are on home ventilators due to neuromuscular disorder, obstructive apnea, COPD, IPF. And fortunately, not all patients are on devices that are included in the recall. So I've been to the Respironics website, spent a lot of time there, and I'll show you snippets from what they're saying online. Been to the FDA, went to the ASSM, has a very nice 2-part webinar online that you can look at and not have to be a member of the ASSM. And I've got 1 or 2 slides I've lifted from their talks. I've been to Drive DeVilbiss website, and they say they're okay. ResMed says the same thing. I talked to the Fisher Pickel rep, and basically it said they're out of the CPAP market right now, not emphasizing that product line. I guess washing machines and other appliances are less subject to recall, I guess. Accompanied by 3B Medical, I've been on their website, nothing mentioned. Transcend, which does the travel CPAP, and the HDM travel CPAP, nothing mentioned. Apex, which has a worldwide footprint, nothing mentioned on their website about being part of the recall. So these are the companies that I've identified that are probably not part of the recall. This is a statement from, and the citation is wrong on this, folks. This should be from the Drive. No? Wait a minute. Which slide is that? Okay, this is actually from Philips' own website. And they're basically notifying you that they've got a problem and they're working on it. And the affected devices, basically they're not shipping any new devices right now. Even the DreamStation 2 is not being shipped, as best I can tell. You still may be able to purchase one, but they're not shipping new devices at this point. And this is their legal term for, we issued a recall and we're making you aware of it. Now, basically, again, they're saying that they're concerned, and they've reported it to most of the regulators, all the regulators involved, and it involves basically 2 processes. The first one is that the foam deteriorates, and you get little black pieces of foam in the air passage. And you may inhale this, you may swallow it. The bigger concern in my mind is not that, but the VOCs, the volatile chemicals, which are released by the foam over time. And in this case, yeah, they're saying that basically the material will be replaced when they can do that. They're putting the blame on, at least in part, the ozone cleaners plus environmental conditions, not the patient operating conditions. So if you have an air-conditioned room and you're using your CPAP machine and it's got the heated humidifier, that supposedly is not going to lead to a premature deterioration of the foam. Now that's to be determined, actually. Let's see. And again, this is sort of a disclaimer saying that when they manufactured these devices initially, they were in compliance with what were the FDA regulations at that time. Now, this is the good news. These are the devices that are not included in the recall. And you can just go to the Respironics website if you're involved with the home care, DMEs, home ventilators. You can see whether your device is included. Unfortunately, this is the list of the devices that are included, and these are major devices in terms of DreamStation support ventilators, the OmniLab, the old System 1 devices. And I thought I would escape without having to do anything, but the System 1 device that I had is included in the recall. And that's just for those who want to look at the graphics. This is what they've, again, this is on their website. And these are all the devices that are included in the recall. These are the trilogies and other devices, A-series BiPAP. So even though they're using BiPAPs in the hospital, hopefully it's by another manufacturer. The problem is with the P-Pure abatement foam. And what they discovered was it was releasing particulates into the device. It was being reported by patients and family members. It was being inhaled. And then the P-Pure foam also off-gases and releases very significant VOCs. Again, they're blaming the ozone cleaners as well as environmental factors. And this is what they said, sent out to physicians. Basically, and it's kind of redundant, but basically that just discusses what's going on. Their plan is to basically stop producing these devices until they get a new set of devices ready for shipment to their patients or their people who have ventilators. Now, they've determined the hazard, and now we're going to talk a little bit about the fix, but this is just the VOCs. Toluene and diethylene glycol, and they're considered to be carcinogens over a long period of time. And down at the bottom you can see that you can get headaches, irritations, nausea, vomiting, and other toxic things. The particulates, headache, irritation, inflammation. So this is a big deal. This is not something minor. So their immediate recommendation is if you got a CPAP and a BiPAP that is included in this recall, stop using it. And we'll talk about how to handle that. For the ventilator patient, it's a different thing, but they're going to prioritize replacing those ventilators, but in the interim, they've recommended the use of bacterial masks. Unfortunately, it sounds like there's going to be a supply chain problem with that too. The important thing to remember about bacterial masks is they're good for particulates, they don't do a thing for the VOCs. So this is just a stopgap. And right now, they're not shipping, they're not replacing. Excuse me for 1 second here. Okay, I'll have to answer that later. But they're not going to replace any devices right now. You can call them as a vendor and ask, and they're going to tell you they don't have a device to send you that's not affected. So, key point. One of the recommendations of the manufacturer is that these devices have a 5-year life, even if they're working. So, If your device has been in use more than 5 years for Medicare, and I think Blue Cross is 3 years, then you need to get with, the vendor needs to get with another manufacturer, and I've given you a list, to see if you can get a supply of home ventilators or BiPAP, CPAPs from another source. And I can tell you that I've talked to 1 or 2 DMEs, and supply chain is going to be a problem on that. Okay, the patient needs to be referred back to their family or their ordering physician if you're the vendor. And unfortunately, talking to our distinguished panel here earlier, they were completely unaware of this issue, which I can understand, because they won't find out about it until somebody calls their office and asks. Now, the other thing that we want to remember is the patient needs to be instructed to follow the manufacturer's cleaning recommendations. Nowhere in the manufacturer's cleaning recommendations is the ozone type device recommended. They don't recommend the UV, but I don't think the UV device is going to be a problem. I'm not an engineer. I can't tell you that for sure, but I don't think the UV devices are going to be a problem. The key thing is mild dishwashing liquid, air dry, dilute vinegar, and that seems to be what the manufacturers are recommending. As a matter of fact, at the beginning of COVID, I called one of my contacts with Respironics and said, are y'all recommending any change in cleaning? And he said, no, absolutely not. And he said, don't use dilute chlorine bleach or anything like that. Just continue with what you're doing, which is a mild dishwashing liquid, air dry, dilute vinegar. Don't use, it sounds counterintuitive, but don't use the dishwashing liquid that says antibacterial. Also don't use a dishwashing liquid that has lotion in it. Basically, good old Ivory, Dawn maybe, Palmolive, that's just plain, not fancy. And you know something? The device that they were advertising cost $300. Do you know how many years worth of Palmolive or Ivory or Dawn you can buy for $300? And a couple gallons of vinegar. Lifetime supply. I did go to the ResMed site, and earlier today I got another email from them, and they're ramping up, but they have looked at their foam, and it's a different foam, and it does not supposedly off-gas, and it does not deteriorate. And that's just a statement from their website. And this is the Drive to Vilvis website, which basically says they also use a different abatement foam. So that's not going to be a problem. But the problem is, what are we going to do in the interim? And this is from the ASSM's webinar, and unfortunately it does not project well, but basically, it basically says you're going to find maybe a third of your patients who have been prescribed CPAP aren't using them anyway. There's about 20% of the devices are the home ventilators, and that's going to be where you're going to have to do some work, get the masks or the filters in, and talk to the manufacturer directly about how to handle this. And the third is, what do you do if you have a CPAP patient who's compliant at home and wants to continue to use? So basically, this is what I've said before. First thing you want to do is to identify patients in your practice. That's whether you're a physician or a DME company or a home care company, and inform them of this. Get them to go out and register their device with the manufacturer. You can't assume that just because you bought a device from a DME company that that Respironics will know that you have a device in the recall. Again, with the non-invasive ventilator, contact Respironics to find out what they're going to do. And with the CPAP compliant patient, you're going to have to, again, look for a new device that's not involved. They may have to pay out of pocket if they're not eligible for a replacement device. And we need to talk about alternative treatments to CPAP. And this is just, again, off of Philips Respironics website, and it shows the registration. You go to the back of the CPAP device, you find the serial number and put it in, and then that'll take you to another page where you put in the demographics. And some of our patients, unfortunately, are not internet active, so it falls upon you as the vendor to help them out in any way you can to get that device registered. This is just an algorithm from UpToDate about treatment of obstructive apnea. The key thing is, if you're AHI greater than 15, there's no question you're going to have to be treated. 6 to 14, and you either have sequelae, or if you're a mission critical worker, pilot, truck driver, you need to be treated. In the range of 5 to 10, basically, if you have symptoms, you need to be treated. And this always puzzles me. If you don't have symptoms, why did you get the polysomnogram? But that's what it is. Why did you get the polysomnogram? But anyway, basically everyone on this slide is probably going to be treated in some manner. You want to educate them. Why do I have to use this? And I did a quick poll of relatives who I knew were on CPAP. 2 said, I'm not included, I'm on ResMed. 1 said, well, I've lost a lot of weight, maybe I won't need CPAP anymore, and stopped hers. And I said, well, talk to your doctor. I'm your brother, not your doctor. But you have to talk to them about risk factors such as obesity, consequences such as increased incidence of motor vehicle accidents, caution them about driving or operating machinery if sleepy. They may have to avoid activities that require vigilance. And if they go for surgery, they need to let their doctor know that they have a diagnosis of OSA. So, first recommendation is behavior modification. And we've talked about the risk factors. If you're obese, you need to lose. Now, there are patients who are positional affected. Most patients, if they assume the supine position, that predisposes them to apnea. So there are devices that keep you on your back, off your back, and you need to kind of send them to the internet to buy that, or if you carry one in your supplies, then you need to get them on a device that keeps them off their back. Need to avoid alcohol and benzos, which predispose. The ASSM, where this slide came from, basically said avoid medical cannabinoids, mainly because we don't know. We really don't know whether cannabinoids would predispose somebody to apnea. So again, big thing on weight loss is there's a position paper from the American Thoracic Society from 2019. If you have the time, you ought to look at it because it's got some great suggestions about how to manage an obese patient. Unfortunately, weight loss improves things, but it does not lead to a complete reversal of OSA. It will improve overall health, it improves metabolic factors, decreases the AHI, blood pressure will improve, quality of life will improve, and there may be some improvement in daytime alertness. But if they lose 20 or 30 pounds, they need to be restudied. And the suggestion is calorie restriction diet, restricted diet, and exercise, which probably is the best. Behavior modifications so they don't binge or yo-yo. There is some drugs available for, and every time I used to order a drug for weight loss, within 6 months there was a recall causing heart trouble. So I put, fortunately I'm out of practice, so I don't order that anymore, but that was my experience. Bariatric surgery will work, for most patients in terms of weight loss, and probably will help treatment of sleep apnea. And there are some general surgeons in town who are willing to do bariatric surgery within certain parameters. So now we are to other basic options besides CPAP. Oral appliances are effective. They're indicated for mild to moderate obstructive apnea. They're also indicated for patients who cannot use a CPAP for any reason, and this would be one of those reasons. You got to have a dentist who specializes in dental sleep medicine. Your general dentist just does, in my opinion, and it's just my opinion, does not have the experience with these devices necessary to really be effective. There's got to be an interplay between the dentist and the ordering physician. But this just shows you that younger age patients, lower body mass index, lower neck circumference, the positional AHI, low AHI, and structural issues help make this effective. And these are the ones right here, shorter soft palate and all. And these are dental things that I don't even begin to know exactly what they're doing that make it a little less likely to be successful. This is from a position paper. Again, unfortunately, I did not get the citation correct, but this is from the sleep multimedia site. And basically, it can be used, oral appliances can be used as a first-line therapy. And again, the emphasis on dentists who are experienced, and a good interplay between the dentist and the sleep doctor. Now, one of my early objections to oral appliances is you were dependent on the patient saying they were using it. And there was no way to really know how effective it was once they left the lab. Fortunately, technology now, you can get a device with a thermistor, and that will tell you at least what the residual AHI is and compliance, that they're using it nightly. And this is just a potpourri of different devices. I don't, that would be up to you and the dentist and the patient as to which one they want to use. And this does not project as well as I would like, but it shows that oral appliances really will increase the size of the air column in the back of the throat. But it does, unfortunately, it does not project as well as I was hoping. Side effects, basically bruxism, TM joint was the biggest problem that I suffered from when I tried it. Some effect, your teeth might hurt, your gums might be irritated, and even though some people use this for the treatment of bruxism, it sometimes unmasks bruxism. And this is just another algorithm about how to manage this. It's beyond really what we're going to talk about. But basically there's an outline of what the dentist and the sleep doctor need to be doing, or should be doing. Okay, so now non-CPAP surgery. The ENT doctors are going to have a field day with this one. Because I think a lot of patients are going to say, okay, let's go do some surgeries. And this just is a list of anatomical areas where that are ripe for surgery. And the most common is the soft palate and the tongue base, lingular tonsils, and basically some resection of the tongue on some patients. And this is just a list of surgical procedures that involve the UVP. And this is another list. The idea behind this is to create, again, an air column in the back of the throat and prevent obstruction from occurring. one that seems to be the most popular right now is the combination of a hyoid suspension and mandibular advancement. Sleep apnea surgery does result in the reduction of AHI as much as 50%. Now, what bothers me about that is if a lot of the literature says, well, we went from an AHI of 60 to an AHI of 30. And 30 is still a significant AHI. It does eliminate snoring, and we'll talk about that in a minute. Side effects include retro swallowing, where you swallow upwards. Your voice will change, and so if somebody likes to sing in the choir, you need to forewarn them before they go this route, because they're going to not be a happy camper. The thing that I worried about and still worry about is silent apnea. And basically, the snoring is a marker for sleep apnea. And yes, the surgeries will eliminate snoring, but it doesn't necessarily eliminate the apnea. So you need to have a follow-up sleep study after any surgical intervention. The nice thing now is home sleep testing has been approved by most third-party carriers. It's cheaper, it's easier on the patient, and so there really is a very little excuse for not doing a follow-up. And again, the sleep doctor and the oral surgeon or the ENT need to communicate well. This is another alternative. This is the Inspire device. Are people here familiar with this? There's one. Okay. Very briefly, this is a pacemaker for the hypoglossal nerve. And back when I was in practice, we had to refer these folks down to UAB. And it was almost a year's process because they had to do a repeat sleep study and then do some attempt at behavior modification, follow-up sleep study. Then they did a sleeping endoscopy, which obviously after the previous talk about COVID, this is probably not something you want to be doing right now. And then they plant the pacemaker on the right side rather than the left side. The left side is reserved for the heart. They plant the pacemaker, and the implant goes to the back of the throat to the hypoglossal nerve, and there's a Bluetooth-enabled device that at night you turn the device on when you go to bed. It innervates the hypoglossal nerve, and the apnea goes away. Now, be honest, we never got a patient through the whole list of things that needed to be done, so I can't give you a personal follow-up on this other than this is available. Now, this is also available. I had a patient come in one time and said, there's the didgeridoo, I can't even pronounce it, but this is an Aborigines wind instrument. Didgeridoo is as best I can do. I have trouble speaking anyway. This one is a tongue twister. But the actual conclusion is that it could be an alternative to CPAP. It exercises the posterior pharynx. And I thought about buying one of these things to just frame and put in my office, and decided against it after I saw the price. But anyway, but leave it to the internet. You can buy a device and get a DVD that talks to you about doing exercises for the back of the throat. And it has been shown that if you do this, it will reduce the AHI. These are the two, Respironics website and the FDA website. I would also go to aasm.org, and you don't have to be a member to look at the two webinars that they had. And the two webinars actually have very good information if you want to read it. So at the end of the day, multiple devices have been involved. The company is addressing the issue. Ventilators will receive their first priority. CPAP should be stopped, but you're going to have to weigh the risk versus benefit and have a good dialogue with the patient. try to get them on an alternative device. If they have to be on a home ventilator, the bacterial filters will work for the particulates, won't do anything for the VOC, but it'll buy you some time. And they need to be replaced the filters need to be replaced about once a week, according to what I heard on those webinars. And to be honest, I've heard anywhere from about a year or longer before the manufacturer works through their backlog of repairs. And it sounds like some of the devices will be just replaced, others will be retrofitted, and I have no idea what they're going to do with the folks that have used the ozone cleaners, whether that's going to truly void the warranty, and whether they're going to hold to that 5-year recommendation, so that if you have a device that's older than 5 years, are they going to replace it? I don't know. Are they going to retrofit it? I don't know. I would say that engineers are very interesting folks, as you know. Any of you here engineers or have an engineering background? When I first started doing CPAPs, and I'd set a patient up on a CPAP device, maybe 3 months later, the patient would come in and say, "Well, Doc, I didn't like the setting that it was on, so I got in the innards and made some fine-tuning and adjusting." And somewhere on the internet, I ran across an engineer who was taking the foam out of the CPAP, the abatement foam out of the CPAPs and putting in something else. So, buyer beware. Are there any questions? Well, I want to thank Mel. This was really a little bit more of a challenge than Mel and I had bargained for. But if there are any questions afterwards, I'll hang around for a few minutes. But thank you again for your patience. Unfortunately, this was indeed the perfect storm of audio-visual problems plus rapid changing with the pandemic, as well as the manufacturer having problems. Thank you. Yes. Yeah. Okay, these are actually off gases. As the VOCs is the question. What are VOCs? They're volatile organic compounds. And that was the toluene and others that I mentioned. And as the foam, in this case the Respironics foam, deteriorates, and it doesn't matter, it's usually off-gassing occurs most of the time at the beginning of the life cycle, but it can continue throughout the life cycle. And the worry is that these are carcinogens that are released. And so in 10 to 15 years, a lot of these folks may develop cancer because of the off-gassing. And as I alluded to, the lawyers are already working on class action suits. And right now it's too early to know what's going to happen with that. But I suspect there'll be major litigation for a while on this.